So in our last panel of the day, we will, as we were saying, we were going to continue explore our red thread on the looking at the impact of the climate crisis, of climate shocks, of limitations and shortages of resources on our capacity to deliver services to populations. And we have looked at it through different lenses today, with a high-level picture with our keynote speakers this morning, from a local perspective, from a donor's perspective. And here we're going to, with the last panel discussion, hear from the level of the organizations, health organizations, insurance companies, humanitarian organizations. I'm going to hand over the floor to our esteemed moderator for this last panel, Serge Michel, who is chief editor at ID News. So Serge, over to you.
Okay. So thank you very much. I just arrived. I wanted to attend all the meeting all the day, but I'm like, as we say in French, a hair on the soup. Now I will try to gather these people. They come from very different worlds, and I will try to get them together around a few simple questions about climate, health, and humanitarian action and development action. And my first question is a bit, and sorry for that, down to earth. If you take Switzerland, 33% of the carbon emissions are from transportation, 23 from constructions and buildings, 23 from industry, and 21 from agriculture. I know that health is a bit spread around these different sectors, but could anybody here on the panel tell me why it's so important to take the sector of health and humanitarian development into consideration for accelerating climate action? And maybe Stefan, you are somebody working on the field. Why is it should it be a priority to you to act on your field and not on the highways, for example? Because Switzerland is gonna vote in a few weeks to enlarge or not its highways, and that's maybe, I mean, more urgent than reducing the engines of NGOs on the field.
Thank you for the question. And I don't know how to use the button. Okay, perfect. Thanks for the question. Pleasure to be here in this assembly again this year, and very thankful for the Climate Accelerator for its role in helping so many organizations to make the changes that we need to see. But the very real answer is it's so important for a humanitarian organization because our patients are telling us that the things they are undergoing, what's happening to them, is often linked and exacerbated by climate change. And so we have the obligation not only to try to respond more today, but to get ready for the things that climate science tells us are going to be on the ascendancy: increased arboviruses and epidemics, greater malnutrition, water scarcity, etc. And if we don't prepare now, we will only be even more behind the ball tomorrow. But just to say before because I think we're going very quick, the needs are already overwhelming. International assistance is dropping by huge amounts, and we see that reflected in the bottom lines of UN organizations, Red Cross and others. 48 of the least developed African countries are now spending more on debt servicing than they are on health and education combined. So we're at a moment where we really have to do both. We heard on the previous panel the impact of healthcare, and I'll leave that to other esteemed people to explain, but we have to get our own house in order, and we certainly have to now start responding in a different way. And what that looks like for us is ensuring that we have more frontline community health workers, local partners that are able to extend coverage, build resiliency into the health systems.
We will come back to the different ways of doing it, but aren't you prepared to that? I mean,
how do we prepare? We prepare by making regional supply chains.
Aren't you prepared? Because climate change is not like a recent thing. So is the NGO sector unprepared for that?
I would suggest that all of the organizations, governments, and companies in the world are unprepared for that. For the disaster to come, we are nowhere near responding or ready.
So the disaster to come, Owen, this is your field. I missed your keynote this morning, but you say there will be speed, scale, and surprise. Tell us more.
Yeah, so I mean, the humanitarian risks are very, very real. I mean, we can, and we don't even need to look too far into the future to look at these issues. You know, if you go back to the Arab Spring, you know, in 2011, you know, part of the, you know, the causes of these big changes across the Arab world was, you know, grain harvests failing in bread baskets around the world, you know, price hikes. So people couldn't afford grain, couldn't afford bread. And this being one of the causes of destabilizing already fragile economies, tipping them into you know, revolutionary systems. And we're still seeing the impacts of that today in Syria. So, you know, one of the things that keeps me awake at night are, you know, breadbasket failures, multiple, simultaneous, that could happen. And, you know, the climate models are showing that these are more likely in a warmer world. So, I mean, I think these kind of big picture impacts, you know, which we have, as you say, scale, surprise, and speed. They're going to come thicker and faster, and they're more difficult to predict. You know, another thing that's deeply worrying is, you know, we had a temperature record in 2023. We're close to 1.5 degrees. We're going to break that in 2024. The scientific community doesn't fully understand why things have suddenly gone into overdrive. And that's very, very worrying. And at the same time, as I said this morning, we're seeing the risks of tipping points, which were once a distant threat, are now actually here right now. And there'll be long-term, you know, foundational drivers of change within society, as well as having, you know, instant impacts relating to sea level rises and other factors. But that long-term impact. And again, and then maybe to finish on this speed, scale, and surprise, and with the kind of warnings that we're now giving, is that, you know, around the equator, you know, the Middle East, Africa, South Asia, these places are going to become more uninhabitable. And it's going to be a slow-moving process over a generation or so, and, you know, worse and worse in the summer months. But that will create long-term, huge humanitarian crises.
Maybe I'd just give you an example so that it puts it in a picture. In Chad, 3 years in a row, they had below average rainfalls, huge drought. This wiped out the cattle, made displacement, took a huge toll on the civilian population in levels much higher than we've seen previously. So 2 years ago, this is the third year that this is in a row. As soon as that finished, you had a huge flood, rose the river levels by 8 meters, causing 500,000 people to be displaced. Those people are then in a camp. The water is so overlogged, they can't go back and plant at harvest time. While they're in the camp, we then have measles. Before we're even done, we're into the next cycle and we start all over again. And now Chad is hosting the whole of the refugees from the neighboring country and the conflict ongoing. And so what we're seeing is the regular capacity of communities to be able to respond is sorely threatened because they're having to repeat repeatedly the next crisis at hand, which leaves them not in the position to be the primary responder that they normally have been.
Sonia, a question for you about health system. Again, Switzerland has one of the best health system in the world. Still, it is one of the systems that emits the most CO2. And it usually, it's like logic. We say, okay, we take care of the patients, we do everything we can to save lives, then it consumes energy. But you say that a better health is also less consuming, less carbon consuming. How so? Can you explain it?
I'm so glad you've come back to me about the Swiss question, because actually Switzerland could do so much more and could lead on this. You're right. The carbon cost per patient in Switzerland is one of the highest in the world. It's also a very, very costly health system. And it's not because you put lots of money that you necessarily get better health outcomes. So my call on is, yes, Switzerland needs to lead the way. Switzerland's mountains are crumbling with climate change, and there's also flooding. It needs to tackle this problem and not just be responding through organizations in other parts of the world. And, you know, so there's transformation is required everywhere. In healthcare, it's particularly important because actually this is a health issue. And if we really want to readdress what healthcare is here about, it's not about dealing with sickness, it's about improving health. And so we should utilize this crisis as a mechanism to transform what we're having. We had a great speaker this morning who asked us to not think of climate as the problem, but to think of it as the crisis, and that the problem is our inaction. So the Swiss inaction is the problem. The health sector needing to take action for something that impacts its fundamental raison d'être is why we should be doing something about it.
No, I understand the raison d'être and the ideas, but how to do it? I mean, the hospital in Geneva, I think, is emitting something like 109,000 tons CO2 per year, which is huge. I think it's the highest emitter of the canton of Geneva, just before the waste burning factory. So,
so it's a good
why will health be better if we emit less carbon in a hospital?
So we need to emit less carbon because there's multiple ways of doing it. We are a wasteful industry. We utilize products that are very high carbon when there are alternatives available. We've got a real responsibility to do that. But on top of that, we need to be prepared for what climate change is going to look like. And so in the example of Chad, not only do we need to continue delivering healthcare, but we need to be ready for knowing what these communities are going to need in 1, 2, 5, 10 years' time and be better prepared. Hospitals do major incident planning, natural, preparedness. And we need to make sure that climate risk is actually one of the things that's on the risk register so that we include it as part of our natural planning and preparedness. And the difficulty, I guess, is that we are not always good at looking into the future. We think the future is in an hour's time. But healthcare contributes, more than aviation and more than shipping to carbon emissions. And we really have to do something about it.
I understand, but what will it do better for patients?
Well, it'll be better for patients, one, if we don't do interventions that are not necessary for health. We do a whole load of things that are not necessary and that actually worsen your health outcomes. So that could be one. We could reduce wastage. We could improve prevention. The less somebody needs to come to hospital, the better it is for the planet and the patients. And just to give you an example, and it's not from a low to middle income country, but there's a hospital in London who decided that they didn't want all the elderly people with pneumonia attending their A&E. So they invested in supporting these people who were in fewer property to actually have good insulation in their homes so they wouldn't need to come into hospital. That is good for patients. It's good for the planet. It's good for healthcare.
Okay, thank you. Now, maybe another link between Geneva Hospital and Africa is that Geneva Hospital is producing the equivalent of 900 elephants per year of waste. So that's should be reduced, but the elephant is like Shaili, you are from a different sector. You come from insurances, and you have to assess risk because insurers have to be careful about what they will cover and not cover. In this conversation, can you tell us how do you assess climate risks? What do you cover? What don't you cover?
So for those of you who may not know, so I work at Swiss Re. It's a reinsurance company. And reinsurance is insurance for insurance companies. So we cover all kinds of risks, from property risks to motor, to liability, life insurance, health insurance. So we're in the business of risks. Now, coming to your question, what kinds of climate risks we cover? There is, again, a host of climate risks that we cover, right? Floods, hurricanes, droughts, heat waves. So and most of the risks that can be modeled, assessed, and priced, we cover them.
And the others, like wars, genocides?
Wars and genocides, no.
Okay. Okay, sorry. But you do cover some human risk in you know.
Yes, I mean, as an example, if for humanitarian organizations, we cover the people who are working in these sectors. So in a way, that would be one of the links to the humanitarian sector, right? So as an example, if you're going to a war-torn country and you need insurance for travel, I mean, that's all covered under in most insurance companies. Cyber as well, yes.
For example, what is the cyber risk you would cover? Because many organizations have been victims of cyber crimes. Is that covered?
Yes, for cyber risk it's a really challenging one because it's very hard to assess the risks, but we do also provide cyber insurance.
Thank you. Stefan, when you spoke about resources, I mean, most NGOs speaks about resources in a way like what money we have to act, but NGOs are also consuming resources on the field, like diesel, water, and other things. How do you assess the margin of consuming less for yourself? I mean, is MSF consuming too much diesel in its operations, for example?
Too much or not enough is a pretty big question because it depends on where we are and what the response need is. Our intent is to reduce the footprint that we have, and we start that with better treatment of medical waste. We are looking at a lot more local purchase and using regional supply so that we're not transporting medicines from Asia to a central stock center and then back to another place. We're looking at a number of ways in this. I mean, on your diesel question, we're monitoring the diesel. We have safe driving. We're very lucky now because from here going forward, our supplier of our big ambulances, Toyota, now has a new Toyota that runs on a smaller engine, 2 cylinders less, and will get twice the mileage of the current. And this is where a lot of the savings will be made by the suppliers themselves, because that's where so much of it is tied up, both in transport and in supplies. And we heard on the last panel some positive stories of medical breakthroughs that are reducing the treatment amount, so they're making savings. What we're not seeing yet, and what we really need to see, is the change of packaging and the change of the way some of these medicines are built so that they're thermostable, so we don't have to have all the refrigeration. Then we've also insulated all of our pharmacies to reduce our waste. We have 85% of our missions have some solar. We'll this year be able to measure how much output that brings, and looking towards, and we don't have enough yet, but looking towards more environmentally friendly products that will also then have a lower footprint and therefore lower waste.
Owen, what he just described is very, I think, very interesting, very good to do. But it's incremental, and you say that somehow the changes must be exponential. Can you tell us the difference and what you mean by that?
Yeah, sure. Yeah, sure. So I mean, actually, but I'll just, before I do, I'll just going back on this other question. I mean, I think as well with the health sector, I mean, procurement is such a huge thing. Like the health sector has so much of its carbon, from procurement, and can send as a consumer, so can send a massive signal to producers if it pushes for low carbon products or zero carbon products. And that's to me, that's like a social tipping point. We often talk about tipping points, and I've been working on tipping points in climate tipping points for 20 years, and tipping points in ecosystems and what have you. More recently, we're now talking about social tipping points. How do we, because incremental action is not going to be enough to stabilize at well below 2 degrees, we won't be able to stabilize at 1.5 degrees without some sort of overshoot and then pulling the carbon down now. So we are looking at stabilizing between 1.5 and 2 degrees. And that's going to take massive, massive effort. 20 years ago, if we'd started early, we could have used an incremental reductions. Now it has to be exponential, has to be at least 7%, 8% per year globally. In the developed world, in Europe, it has to be more because of the justice and equity issues. But we know it can be done. So, we think framing things as an exponential trajectory, that you need to be on pathways 7, 8, 9, 10% per year is very, very hard to do. It's very tough, but it is actually possible. I think sectors like the reinsurance sector, who are on the front line of understanding climate risk, they're the sector that I believe is one of the sectors that has reduced its emissions fastest. I'm not sure about Swiss Re, probably, but there's a sector it's done very well because they understand the risk. And other sectors need to move in the same direction. So it's definitely exponentials, not incremental now.
So Shaili, yeah, he just mentioned that Swiss Re takes risk seriously, and I think that's your very business. But you have a research department, a very impressive one, and you are one of the few business organizations that took seriously. I mean, the GIEC, how do we say in English? The MPCC. IPCC, sorry, reports very seriously from the very beginning, when the rest of the business would say, okay, these are some few funny activists for climate, but you took it seriously because you knew that there were a risk of floods, heat waves, and everything. So how do you assess now the risk? How do you do to understand if your company is going to be overwhelmed by demands from clients who want to assure their losses, and if you're going to be bankrupt, or if it's going to be okay for you?
Well, for a reinsurance company, these risks are priced on an annual basis. So we are globally diversified. So it's not that with one natural catastrophe or even several that we will be going under, right? We also have huge capital reserves for that purpose. I mean, Swiss Re's been looking at climate change since the first publication was 1970s. We have about 50 experts working in the NatCat division alone, and for people working in emerging risks and forecasting, and every risk has to be assessed and modeled. So there are risk modelers and risk assessors, risk engineers who go out there and look at how these buildings are made. Are they really resistant to different kinds of natural disasters? So there's a lot that goes into the final product that actually comes out, right? So before you actually develop a product, there's a lot that goes into developing that product and making sure that along with the risk transfer, so along with the product itself, there's a lot that goes into the risk prevention and risk mitigation. So we have client discussions to make sure that they're aware of the risks, that they're taking actions to mitigate the risks. And now the concept of build back better is also something that we're looking into to see if we can integrate more of those principles. So at the end of the day, we want to make sure that these risks, that we can take them on, because that's what our value proposition is.
When Owen says that there will be speed, scale, and surprise, you prefer not to be surprised.
We prefer not to be surprised.
Yeah. Are you not surprised when there is a hurricane, when there is a heat wave? You're not surprised.
Well, we have a lot of modeling that goes into it, but with climate change, those things are, we're seeing very erratic patterns. So it's not always possible to predict everything, right? But we do have models to make sure that that we're able to still price these risks.
And do you share the quite pessimistic view of Owen, for example?
I did not see, the reason I'm surprised is because I don't think you're pessimistic. I think you're just saying, hey guys, let's hurry up. I think that's very different to saying, hey, I mean, pessimism to me is, giving up, and I think it's very optimistic.
That said, though, that some risks are becoming uninsurable, I guess, and we're hearing more and more about, houses in the US, for example, becoming uninsurable.
Yeah.
Which is, you can manage that risk, but it's quite an interesting dynamic that's happening.
Yeah, and I mean, in the case of Hurricane Ian in 2022, as an example, I mean, the U.S. population over the last 50 years has grown about 60%, and in Florida, that's 200%. And when you look at the landfall in where Hurricane Ian was, it's 600% population growth in that area. So it's not just climate change, right? It's urbanization, asset concentration. I mean, that's what's driving up the insured losses, which for local insurance companies, that's very difficult for them to cope with these risks. And that's why this, diversification, but also, I mean, all actors coming together to play a role is important. To have, urban planning, to have zoning laws, to have building codes, and the implementation of it, to have regulations that support that, to make sure that, that you have limits on lawsuits, as an example. I mean, so you have the regulations, you have the social environment, you have economic factors, and the risk itself. So there is a lot that goes into making sure that risks continue to become insurable.
We'll come later to what you highlight, like public-private partnerships and everything. Sonia, Stefan, you wanted to say something? Sorry.
It was a question, because my understanding of the planetary overreaches and the boundaries is that the mapping does not actually take them into consideration on the overlap effect. You could correct me if I'm wrong, but my understanding is that on IPCC report is the most conservative estimate, and that has to be done for political reasons. But the other planetary overreaches and boundary overreaches are not modeled as to their effects. And that means that we're facing a few more unknowns perhaps than we may think.
So you are the pessimist guy here.
No, I'm not a pessimist. I'm a realist. And that's why we have to get prepared, and that's why we have to do everything that we can, because the more steps that we take, the likelihood is that we're going to reduce whatever level of difficulties we're going to face.
All right. So, Sonia, you say that to reduce the emissions of health sector, there are two ways. One is integration, one is innovation. Would you describe these two paths?
Okay, so what I mean by integration is that if we're going to be serious about tackling this level of challenge and risk, we need to integrate this in every decision that's made in healthcare at every level, in everything. So that's the products you buy, it's the prescriptions that are made, it's the way you build a hospital, it's the way you try and focus on prevention, it's the way you sort out your governance, it's about board accountability, reporting to the public. So all of that should be integrated into standards. For hospital, we've been developing some standards for hospital accreditation. It should be a normal part of what a hospital needs to do in order to function. So that's what I mean by integration into everything we do. In terms of innovation, it's because actually the scale of the challenge is so huge that we're not going to answer it by just doing incremental things. So for instance, in products, if we just say to the supply chain, sorry, we'd just like some slightly better products, you need to be lower carbon and you need to be this, you need to be that, that may not be sufficient. We need to go out there, and I think there was an example earlier today, and say, actually, guys, we need something completely different. And we need to reset the bar to say, actually, what we need is products that are low in water footprint and carbon footprint. There's an example with staff uniforms that are more comfortable for staff to wear, that are, locally produced and all the rest of it. And what you end up with is very different solutions. So it's a call for integration into everything you do, but also to open up your creativity, the innovation for doing things completely differently.
So innovation in your mind is not like a, technology. It's more innovative ways of doing things.
So some is technology, but there's a lot in healthcare that we could do through processes. At the moment, you talked about waste. It's not just about products. It's also about the wastefulness in the way we do things. We don't have to bring patients into hospital for everything that needs to happen to them. We can do things significantly differently. And in a way, COVID helped us that. We've done a lot on telemedicine, but it's also in terms of, I mean, I'm just thinking of an example around products, which is gloves that are used. It's not just about let's reduce the carbon footprint of every glove, you know, so that you can waste less, but it's also about how you use them. And, you know, Great Ormond Street in London actually saw that people were using them as a matter of habit. So it's going into the behavior change and empowering health professionals to use it differently. And they reduced in 1 year 5 tons of plastic just by having a change in their awareness around glove use. So it's processes, it's behavior, and it's technology. But we mustn't be lured by the fact that technology will save the day, because it won't be sufficient on its own.
Thank you very much. Owen, I have a question that is maybe a bit polemical. In the very long and thoughtful preparation of this debate, you sent me a sentence that says, transformation will need to be fair or it will fail. We need to strengthen democracies or risk backlash. Democracy is as a precondition reminds me of decades-old speeches with accusation from the global south that the West wants to impose its values and kind of a neo-colonialism. And anyway, it seems hard to go now to Sudan and speak about democracy. Do you think how to proceed? If you say democracy is needed in the course of action for climate change, how are you intending to do it?
Well, I suppose, you know, well, starting off with democracies in Europe, you know, we're seeing how democracies are attempting to deal with some of these big issues, you know, like Germany creating policies on heat pumps, for example, that are then largely rejected or certainly problematic with a lot of people who find them very expensive. They find that, oh, I'm going to have to pay a lot more for to heat my house, and it seems unfair when, you know, perhaps the wealthy elite aren't having to pay to reduce the number of private jets they take, for example. And we see the same in France and in the Netherlands. When it comes to agricultural policies, the farmers don't feel as if the climate policies are fair. And in some ways, this is a communication issue, because in some ways, the policies are the fairness has been thought about, but in other ways, you know, profoundly, they could be more fair. The policies being developed in democratic countries, if they're harming the majority of people, they're not going to be popular. But there are different ways of framing policies and developing policy solutions where that are far fairer and that would get much more traction, for example. And I think, you know, Sweden and Norway are possibly good examples of, you know, policies on carbon taxes over the last decade or so that have had very big impact on the transformation and have largely been accepted by societies. So I would say, and so then, and again, staying in Europe and maybe America too, you know, we need to make a massive transformation in the next decade. It's absolutely certain if we're going to deal with this. Now, and people use rhetoric around, oh, we need a Marshall Plan or other kind of wartime metaphors. I feel a bit uncomfortable about those kinds of metaphors in the case that they could be interpreted as we you know, remove bits of democracy and allow, you know, governments that, you know, full control to take these bold actions. I would much rather see us build stronger democracies to deal with these issues. And I think one of the reasons we're seeing a rise of the far right over the last few years is because over multiple decades, people feel that democracies are not giving to the majority of people. The countries are growing wealthier, but that wealth is going to the wealthy elite, and that sets in train, a series of distrust, or a sense of distrust. So even though people support climate policies, they know they're very worried about climate. They don't really trust governments to act, because they can see governments aren't acting in their best interest. So my number one thing I'm thinking about is really, how do we strengthen democracies, through, redistribution of wealth, through citizens' assemblies and these issues that have helped diffuse very polarized areas and help bring people together around, contentious issues. So, and I think that we can't go telling the rest of the world what to do unless we get our own house in order, I suppose.
Sure, but Switzerland is a strong democracy and still has refused by a small margin a carbon law like 2 years ago. So how do you explain it? I mean, and it's also a wealthy country, so it's not like people are starving and just saying, I prefer to eat than save carbon.
So what was the last bit? You said that Switzerland didn't manage to get there.
No, they failed by a few percent to accept a very reasonable carbon law that was supported by the government and by the parliament.
Yeah. So again, we need to do a lot more work on working with citizens on engaging in these issues and bringing them on a journey. It's quite possible that in this case, people didn't feel that the policies were fair, and they needed, and so they weren't supported. So if perhaps if there was citizens' assemblies to help with that process, that could have helped with the fairness sense to it.
Okay. Thank you. Last question, and then the Q&A. Shaili, you wrote me that together with mitigation, we need to invest in adaptation and invest. So whom do you mean by invest? Is it your company, Swiss Re, or is it we as a whole?
Yeah. So I mean we as a whole. I think there is a role for everyone to play in making sure that these risks are mitigated, and that we really invest in adaptation. And that relates to what an individual can do at a level of a homeowner or at the level of a farmer, to governments in terms of having the regulations, the funding, the management, the policies, to private actors like insurance companies who can then support the adaptation, either the building of it or in sort of the contractual terms.
And do you see this investment being done, you as a privileged observer?
Not as much as is needed. And I think there are several factors that lead to that, right? So there is a lot of these investments don't really, it's not the same sort of, what you observe in the news when a disaster happens. With adaptation, you don't see the disaster. And so it's hard to invest in something where you don't see the impact. So I think we need to create more awareness around the benefits of adaptation, which far outweigh the costs. A lot is also to do with how things are measured, and we need to have the measurement for adaptation the same way we do for mitigation.
Thank you very much. So now, questions and answers. First, the questions. Who has a question? Yeah. Madam? No, the microphone is going the other way, sorry.
It's coming back.
It's coming back.
Yeah, hi, I represent online people. So, so the first one, I guess, is more for Sonia. It's how do you suggest we encourage suppliers to implement sustainable innovation and practices, specifically in the health sector, from Ingrid Capes. And maybe the second one is more for Owen. So it's Mohamed from the CIA in Senegal. He asks, so I'm going to translate this, why not think of a more inclusive reflection? And that means implicating people from all the levels of society and communities.
What's the start of that question again?
How to, so this is a translation, so maybe it's like too deep old translation, but it's why not think of an inclusive reflection, and this would imply involving communities at all levels.
Shall we start with answering that? Sorry, so yes, to engage with, I guess the first thing to say is that the health sector and all its related organizations have a huge voice because we buy an awful lot of stuff. And actually, if you consider how much we buy, if we could get our act together and give a common signal to everybody that this is really important, that would make a huge difference. So one is realizing that we have a voice, that by giving a strong signal, we can make a difference, even towards pharma. I think the other aspect is to make sure that it then becomes part of every criteria that we put in place. We could have much greater coalitions amongst what humanitarian organizations are doing, the UN are doing, and healthcare organizations, the International Hospital Federation, for instance. Actually, if you came together on some common top 20 products that are used, we could start making a big difference. So there's something about doing that. I think in terms of innovation, it's about saying, if you develop some really innovative products, we will buy them. You know, if they meet our criteria, so this is beyond trying to restrict a product into some very tight standards, and it's about opening it up and saying, actually, if you find a way for us to be able to develop, say, a low carbon theater that uses no energy, that is got good lighting, that is better for surgeons and patients and all the rest of it, you can open it up in a completely different way and get very different solutions. And I think we need to use both. I would like to use the opportunity, though, to also say that one of the great routes to a solution is to develop all of our leadership competencies around this. Sustainability and understanding what it means for your organization is a leadership competency. We all need to develop those skills so we can address what's going to be happening tomorrow and in the future, because it's going to change, it's going to keep evolving, it's going to keep getting more complex. And that's one of the ways that we can skill ourselves up. So it's not just about asking the suppliers, it's also about taking on board that element ourselves. Thank you.
And on the other question, if I understand it correctly, from Mohammed, on more inclusive processes, and maybe I'll just mention, you know, something at the global level, which I think is one of the most exciting developments in global governance of our generation. So at the UN General Assembly on the sidelines last week, there was the launch of a global citizens assembly. And this builds on the pilot run up for the Glasgow COP climate summit a few years ago, where they ran a sort of experimental citizens assembly, and where they bring in, you know, 1,000 people from many different walks of life, chosen randomly around the world, which means if chosen randomly, you have people with high levels of education, but also people who are completely illiterate. And they created a process, an inclusive process, to bring these people on a journey to discuss climate responsibility, justice issues, and solutions. And they came out with a really, really sort of groundbreaking process and a set of recommendations supporting deep action. I think with the new Global Assembly and trying to find a sort of more, you know, permanent footing for it over the next decade or so is a really, really important step in evolving global governance, and for you know, thinking about sort of alternative, more democratic processes, also running alongside, you know, the United Nations and others, which are fantastic institutions, obviously. So I think there's some innovation happening there. It does also make me reflect on the conversations today that you know, sort of staff assemblies could be a useful process for the big humanitarian aid agencies and health agencies as well, going on their journey to decarbonize their operations.
Thank you. Question to Sonia. So I'm Sylvain Delucia. I work for Geneva University Hospital à Sujet. I work for ecological transition. We work hard to teach people in our institution to make them aware of the climate and environmental and health issues. And if we succeed, we will convince 1% of people in Geneva. The next step will be to inform and provide good influence to the 99% of other people. How to do that? I'm asking under the surveillance of media specialists.
Thank you very much. So I do think we need to use our media colleagues to help spread the message for sure. I do think that by making the message a more generic one, that it's part of everyone's responsibility, that as leaders, we need to do that. I mean, you're right, we need to train health professionals and leaders that this is part of what we need to do. But I also feel that if you get, I think it's like it was said this morning, a health professional who talks about it to their patients, will also make a big impact. This is, if we're going to take a patient and their context into account when you're having a conversation with them, then it should enter into the conversation. And I've heard midwives saying, yes, when I'm talking to a mother who's just had a child, and that is exactly the right time to start talking about nappies, breastfeeding, and all sorts of environmental impacts. And that can carry a lot further. And the person this morning, I can't remember who said it, was our leaders also go to their doctors and health professionals for various things. So it's an excellent moment to educate them. So maybe we can use our voice as health professionals, as trusted health professionals, not to critique civil society, but to encourage them to take up their voice and their role. Thank you.
Thank you. My name is Am from MSF. Actually, I was listening to the conversation. I was trying to reach, maybe my conclusion is wrong, but I feel it that the first question you raised about why we need to work on health and humanitarian is a small sector. Maybe what I hear from everyone, it's also a call for help because other sectors are not able to move anything because of the control of the large corporate capitalism and not being able to pass a small carbon emission in Switzerland. So imagine, how can you do it? So the health was a way to go around that because this is a human, this is me. And trying to do something like what happened in the tobacco industry in the 70s when they forced tobacco industry to pay certain taxation and so on, working from this perspective. Maybe it is not, I have no idea, but I would like to hear, is it something, because if this is something deeply interested, so we will be so much careful of what to adopt as innovation, not innovation, what to invest on or not invest on. We speak about what initiative we need to speak about because there is a larger goal. Is this something you believe that's something that we can use to buy in, or I'm just, I take it far? Thank you.
I'll jump in here, but I think this morning we talked about changing the narrative and discussing the inherent financial systems that are behind everything. So yes, I think we need help. We need to change those financing systems. And to give you an example of what that looks like in healthcare, at the moment, healthcare is financed by activity. The more sickness we deal with, the better we profit from it. It's not a good model. It's not the right model. And we need to find a way of financing health, not sickness, to try and help drive some of that change. And I think that's probably just an analogy of the sorts of discussions that need to happen at a number of levels. I am sure it's the same in the humanitarian sector and in the insurance sector. So yes, we need help, but we need to fundamentally rethink our financing systems as part of that.
Stefan, maybe a word on this?
Sure. I mean, the first analogy was around the tax. And of course, that was an integral part of how this transition was supposed to be made. But a number of forces, political, financial, and others, have recast that carbon tax into something bad that is going to hurt people and cause more polarization, et cetera. And so we've seen that unified carbon tax disintegrate a little bit, take a lot more time. There are some other initiatives trying to bring it back and bring it together to have one global system. But right now, the price on on traded carbon is nothing. So it's not yet significant enough, but it definitely needs to happen. And then to Sonia's point on transforming how we see health, that's exactly what we're doing, not with the same wonderful, eloquent language, but we are truly putting more effort into trying to prevent disease and keep people healthy, give communities the tools to be able to intervene early on things like diarrhea, on malaria, on so they don't then have to spend the money to go to the hospital far away, take on all sorts of additional debt, etc. Expand the community health worker network so communities can care for themselves, and then keep our resources in the background for secondary care where the system really needs the extra help. And we've changed our supply so that we have regional supply in order to reduce the costs, et cetera, et cetera. But we also really need to start looking at new ways. And one of the examples there, because one of the things we haven't talked about today very much is about nature itself. And we can't just reduce carbon and reduce waste in a vacuum. We have to look at nature itself and the way that we're affecting nature, which goes into these overreaches. So one of the things that we're looking at now is working with Wolbachia, which is basically a bacteria that gets to hijack itself on a mosquito and releasing these into the wild, because this bacteria means that the mosquito cannot carry dengue or Zika or other viruses that we know are exploding. Right now, the cost of doing so is prohibitive. And so we're trying to see how we can lower the cost, lower the intervention, make it far more community acceptable by using a listening technique called radical listening from one of our partners, where we went out and spent months and interviewed and discussed with thousands of people before going about it. And then what this does is it changes how we're generally doing things, because how we generally do things is we do all of this spraying to destroy the mosquito population. That spraying then goes into the water systems and is taking out things on the bottom of the food chain. Other big billionaires have come in trying to wipe mosquitoes out of the program. How many things rely on eating them also? So trying to work with nature, with homegrown mosquitoes, but a bacteria that's imported, to design a whole new way of working, and then we won't have to be treating thousands of cases of dengue. We could get ahead of it and have a new tool in our toolkit to be fit for purpose for tomorrow when dengue starts to make its way through much of Asia and much of Africa, where currently it's not prevalent.
Thank you. Other questions?
Hi, Mary Jean Buer. I worked at NRDC many years ago in California, and we, together with other NGOs, we worked together to put in place the Pavley Bill. There was a CO2 emission standard for vehicles, passenger vehicles. And there's a long story behind it that has to do with the Clean Air Act and why we did that. So the point is, and I kind of follow up on what you said about carbon trading, because I also worked in carbon trading myself. And I'm really sad to see how the carbon trading has played out. And what do you think about standards, and also for the health sector? Standards, for example, in this case, it was for the entire fleet of Toyota or GM or whatever. So basically trying to push in technology through the entire fleet. If they wanted to put electric vehicles, at a maximum and then sell a bunch of SUVs, they could do it. If they wanted to have, great, technology on the transmission or whatever to produce, better cars all over the fleet, they could do it. So they did it their way over the fleet. So what is a way that you can do this in the health sector? I don't know how it works in the health sector, but if you would have hospitals that are owned by the same investor, that maybe different hospitals can go more forward than others, but overall the entire investment, the entire holding is having to meet a certain CO2 standard for all of their activities. And that way you incentivize people to go forward. Maybe one department can go faster than another. And so I just wanted to know what you think about that.
It's great that you raised that, because actually we just launched some standards for healthcare, for hospital accreditation this summer, which is exactly to your point about starting to make sure that this is included in hospital accreditation alongside other patient safety issues and all the rest of it. So it should be just a part of that. Of course, if you looked at the standards, it's still a very relatively low bar, but it's really important to get there. And I think it's a way of raising the sort of bottom common denominator so that everybody moves forward. But we also need that innovation to drive something that's further, because it's not going to be enough to do what's in standards. And even if everybody's sort of met often standards drive a bottom minimum. So I think you need it to help drive progress, but you need something much more innovative, transformative to drive the real action that's needed. And I mean, as part of that, we're trying to look at certification to say those who want to demonstrate they're going further and faster, to recognize that, because chief executives like to be recognized for the work they do. But, I think we're going to need all the levers in the toolbox. So it's going to be taxation, it's going to be standards, it's going to be incentives, it's going to be insurances changing their leverage points about, I mean, we're trying to influence health insurers to say, why not just insure, work with hospitals that are certified, that have got the standards, that meet a certain level. It would be a game changer.
No question?
Can we ask a question back to the audience?
There is one.
Well, it's more reflection, and I would love your feedback. I feel that one of the issues we have is the great divide between climate and biodiversity. Going a bit on what you said, at the end of the day, the two crises are probably correlated and dangerous, but we have a great divide. We have CBD on one side, IPCC on the other, COP climate on one side, COP biodiversity on the other. What are ideas to try to bring things together? And maybe further, maybe it's the same idea, maybe not, but we talked this morning about changing the narrative. Instead of talking about climate crisis, what if we talked about a pollution crisis, which brings back to the responsibility of the humans? And then it affects both climate and biodiversity, and that focuses only on one of the two outcomes. Thank you.
Yeah, I think from the very beginning, before we even got to COP, these things had been tried to be put together through the One Health lens. And those discussions have been ongoing for more than 20 years. But they're through sectors that are not incentivized to work together. So you have overuse of antibiotics in animal farming. Your nature people would love to reduce it. But first, they weren't talking the same language. They weren't talking together. Then they got all together, but not incentivized to do so. And so that's just kind of gone on until we ended up with tackling climate. There are a lot of organizations now. We're not one of them because it's going to be a little bit longer before we are at both. There are a lot of organizations fully realizing the difference and the need to bring the two things together and tending both. What we're doing instead is we're partnering with organizations that are working on the biodiversity side. Because if we're going to have a resilient community, you're going to need the restoration of nature. You're going to need sources of income, which give greater livelihoods, and then the medical care, the preparedness, et cetera. So rather than trying to become all things to all people, we're working with other organizations that's their specialty and working together in partnership in order to be able to have both lenses. But changing the narrative or the words is something that's been tried a few times now. We're on planetary health. We're on, it's not a climate crisis, it's a health crisis. I think that search, and we maybe talk to communications experts, that search has been ongoing for probably 30 years of how to properly communicate in a way that you're going to get the type of response, preparation, care that you want. We're not the experts. We're going to need help from others.
Sonia, you had a question to the audience.
Well, I just wanted to piggyback on that answer, because I think there are so many different points of entry and we shouldn't get too hooked up on what our point of entry is. But, we can reduce environmental impacts. We can reduce the burden of disease. We can reduce social inequity. All of those are good points of entry. But the same goes with improving our natural environment, improving health and well-being, and building on our social assets. So to me, use any one of those points of entry and just run with it, because actually they'll all bring the others with it. My question to the audience is, you've heard us all respond, but what would you like to see us do? And have you got any better narratives? don't have to answer now. You can write it later on a postcard.
Okay, I think we run out of time, or just one last
Last
question.
minute, cross
Okay.
the line.
Yeah, just a comment, a kind of response to your question, but I'm wondering why the emotional side or the implication of all this challenge are so much, so little considered in this discussion. We are always focusing on solution, technical solution, plans and everything, and assuming that we are basically rational beings, but we are not. And I'm wondering if in this discussion we could integrate more expertise on social psychology to consider how to influence within organization and more broadly in the society a change.
Thank you so much. And I'm going to resonate with that. And I think this is also going back to what we discussed in the opening. It's also how do we transform the climate grief into hope? And that's very much a work that's connecting, building a bridge between the inner transformation and the outer transformation. I know that's something we have discussed with a few people here also during coffee break. And so I think what I would suggest is also in your narrative to bring that emotional aspect of how we reconnect to our shared humanity, because that's also at the heart of your mission, also as a humanitarian sector. It's not only about data and KPIs and how do we reduce carbon emissions, it's also about that shared humanity. So just an idea. Thank you so much.
If I could just respond to that, I think that's a very good point, because we are in a growing empathy crisis where the other is a source of fear or non-care. When we come back to the earlier question on the investments needed for mitigation and adaptation, 15 years ago, collectively, the heavy emitters said, we caused this. And they talked to their populations and said, we caused this, and we have to help the developing world skip over that oil phase and do the adaptation and mitigation necessary. And now, where are we? We're at not paying those bills and at looking at how the climate affects ourselves in first world countries. You don't look at the storm that went through the Caribbean, you just look at people in Florida dealing with the storm. When it came to COVID and other infectious diseases, it's the same. We charged the developing world 2 to 3 times the price that we paid for vaccine on a program that was supposed to help the developing world. We promised under WTO rules that when there would be an epidemic, we would share and transfer technology, which we still haven't done. So we do have to find a way to tap back into people, because we have so many forces trying to go against the carbon reductions and other things just for profit, and others working on this polarization in society just for power. And the two things are quite linked. Our shared humanity does bring us all together. And if we tap into that in a way and really realize that if the planet is sick, we're sick. And we're not going to be healthy until we're all healthy. I think there really is something there that can go a long way.
Owen?
Yeah.
Closing words.
And on the empathy question, which I think it's really important. But for me, what I've seen over the last few years, when Fridays for Future emerged, then suddenly you just felt there was a new heart and anchor in the world on this issue, and an emotional connection with it, with people, for the people who will be alive at the end of this century. And it really, really does matter to them that we're not making progress. And I think that created a whole new legitimate voice in this discussion, which has completely changed the conversation. I think maybe after COVID, I mean, that voice has then become quieter, and but I think there's moments again for it to get louder. I also think that some of these legal cases that are coming up in Switzerland, I believe, with some older people, and then with youth in sorry,
it was grannies.
Yes, indeed. Oh, right. And with the youth in the US and in Netherlands and places, I think this is creating new narratives in society based on the legal system and legal accountability. That to me is it sounds very technocratic, but it's actually bringing a new sort of emotional level to the challenges, and I think it's the legal side of things is an absolute new frontier in action on these issues, and also linked to health, very closely linked to health.
Thank you. I think this is it. I'm sorry. I think we have run out of time and we still have a few speakers. So I would prefer to give the stage, leave the stage.